If you suffer with loose dentures or you are embarrassed to smile because you have missing teeth, here's how mini dental implants will change your life.
I have 4 teeth missing in the back.
I couldn't hide it any longer.
I became almost antisocial.
I couldn't eat almost anything.
I was having a hard time.
I'm gonna go and get this done.
Because you don't want to go around without teeth.
Getting the mini dental implants was a life changer for me.
There was no pain.
What pain?
I can eat everything. It's unbelievable.
I don't have to put all the goo on.
With these, I can eat everything.
But now, I can socialize.
I don't have to worry about being embarrassed going to a restaurant.
It's the best decision I ever made.
It hasn't made my life easier, it sure has.
The mini implants are the only way to go.
It's been fantastic.
I don't know what else to say except it was almost a miracle.
It's just so much better.
I'm happy. I'm very happy.
It literally changed my life.
My dental implant has changed my life.
I feel like me again.
My confidence has really gone through the roof.
I love it.
It's incredible. It is. It's absolutely incredible.
Hello everybody, I'm John DeSciullo and welcome to Innovations in Health. We are welcoming Dr. Stephen Uchida from Smiles Forever, and we're going to talk about the mini dental implant procedure where you can be you again. Imagine folks biting into that ear of corn, the foods we love here in Hawaii, pain-free, and it's something that can be done in the office. You are going to be amazed at what you're going to hear about with the mini dental implant procedure. Have a better life with family, friends, and food. The mini dental implant. It is 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive, FDA approved. Dr. Uchida, we're going to start by talking about the lower denture, because I know that was how you started with your mini dental implant practice. And show us with this example how the mini dental implant can offer stabilization for a lower denture that, as I've heard you say, has a mind of its own.
It does. This is where it all started for me with mini dental implants. Nearly 18 years ago in the year 2001. Basically, it's 4 implants in the lower front area of the lower arch, and the denture simply snaps on over this, and this is what I show my patients all the time.
Look at that, that's the shake. You're famous for that. We've seen that before.
It really is. It just shows people how stable it is and how retentive the mini implants are with just 4 of them in the front of your lower mouth.
So many people, Dr. Uchida, probably with the lowers, it swims around on the gums and, like you said, has a mind of its own. And now the stabilization with the titanium post that is a part of this holds it into place.
It really does, and when you have that, you don't really need the goop or the C-bond that holds the lower denture down anymore. It's like apples and oranges before having the mini implants and after the mini implants.
So folks, if you have a lower denture, odds are you probably have an upper denture. And Doc, you have an example of how the mini dental implant not only secures the upper denture in place, but it brings the sense of taste right back again.
It does, it really does. The upper mini overdenture helps you with your upper teeth, and in your upper teeth, there is no palate right there.
So that exposed opportunity gives the sense of hot, cold taste that's coming back.
It does. It allows your hard palate to feel and taste your food again.
And look at how that gets stabilized by snapping it into place. And there it is. And that gag reflex that sometimes comes with the upper denture is gone because of the sense of confidence. Not a sense of confidence, it's full confidence.
You can just go ahead throughout your day and not worry about your dentures when you're eating or singing or laughing with your friends or even sneezing. You don't want your denture on the other side of the room.
No, and so many people have had experiences where the denture falls out for those very reasons.
A lot of people are afraid to sneeze because of that reason.
Yeah.
Getting the mini dental implants was a life changer for me.
If you're concerned about your looks, then obviously this is the way to go.
Not a second thought about it. I would do it again.
How could you go wrong?
I just can't say enough about how I feel.
It's one of the best things I've ever done in my lifetime. I mean it sincerely.
This is something that is so incredible.
I feel a lot more confident. My smile feels better.
And it brought a lot of confidence back to me.
After the procedure, wow. Yeah, you smile.
It's just unbelievable what it's done to my life.
I feel like I do have more confidence than I did before.
It's going to sound corny, but I mean, it is a life-changing event.
Changed my life.
So this is giving you your life back in a way that is what you used to have. But if you have a denture and you're looking for something that is an upgrade to really look like a full set of teeth, this next one that you're going to show has less plastic in the top of the mouth.
Exactly. This is an upgrade from the upper overdenture, and it's called the Fixed on 6. And basically, we have 6 implants on the upper arch right there. And here's the teeth that fit on it. You notice that there are no areas of red on it, so there's a lot less material in your mouth. And it simply snaps on like this.
And that really is like almost like a full set of teeth.
It is. It is. And you don't take this off. It stays up on there. The patient doesn't take it off, so for all intents and purposes, this is fixed. It's just like your natural teeth again. You can see the difference in the monoplastic that the Fix on 6 does not have compared to the upper overdenture.
Yeah, that's a real upgrade. And you know, as we like to say, God gave us our baby teeth,
right,
and then our adult teeth,
right.
And now with the next example, Dr. Uchida, it's as if you're going to give us our third set of teeth.
So this is called the roundhouse, and basically it's fixed, it's cemented onto 10 to 12 implants in the upper arch, and it's cemented on just like that, and it doesn't come out.
So it's a permanent solution, really.
It is.
Yeah.
It's like having your own natural set of teeth again.
Wow.
Like you said before, your third set of teeth.
Yeah. Sometimes you don't need a full set of teeth for a mini dental implant. And sometimes it's just a single tooth. You know, maybe there's somebody that's been out, you know, with a fishing excursion and they get a tooth knocked out because of some sporting adventure that they've gotten into or an accident.
Right.
But let's talk about that, because you have an example of how a mini dental implant with a single tooth can make a life-changing difference.
So here's a single tooth mini dental implant. It's rather hard to see which one it is here.
I can't tell.
Yeah, it looks so good. And there's an implant right in there. It's very small. You can barely see it.
And that's that titanium post that we talked about.
It is. And you simply seat a regular crown right on top of it, just like that.
And Dr. Uchida, we should mention that this is not a little tooth that comes out of a box and just gets plugged in. These are hand-fabricated teeth for the patient.
They are.
And this is something that's done in your office.
It is. It is. We do this many times a day.
Yeah. Tell us where your offices are.
My office is in China Lakes, KAILUA at 1058 KEOLU Drive, and also near the Almoana Center at 1331 South King Street.
And you can go on the web at thesmilesforever.com, and a phone number to call is 808-762-2247. Dr. Uchida, the teeth that are in the back, some people say, well, it's out of sight, out of mind, I'm not going to worry about it. And that's not what they should do, is it? If somebody has some teeth in the back, the mini dental implant procedure can help them.
Exactly. You should chew on your back teeth. That's what your back teeth are meant for.
Very important. That's where all the
it's very important
goes.
And also for supporting your face.
Yeah.
Your facial structure. So what we want to do is we want to replace your back teeth, and we can do that with mini dental implants.
Show us how in this example.
So here are 3 teeth that are missing right here, and you can see how the mini implants are placed right in their positions. And we simply put teeth right back in there just like that.
That's amazing.
It is.
And it looks so natural. It must feel so natural too.
Right. You can't even tell they're there. That's the beauty of the mini dental implant.
The mini dental implant is an in-office procedure that can happen with Dr. Uchida and his team. You have something too in your office called All on 4, Zygomatic. I saw that on the website, thesmilesforever.com.
It is.
How does that integrate with the mini?
The All on 4 and the Zygomatic implants, they are options to the mini implants. And they are something that we talk about when we have consultations as other options besides the mini implant. And it's good because in our office we are able to offer all 3 options and allow the people to see what option they would be interested in.
All of that is a part of the consultation
Right.
that will go with it, and it's a free consultation that you offer.
It is.
So we're talking about the mini dental implants, and we're going to talk more about that as we continue on with Innovations in Health. But Dr. Uchida, where did you grow up?
I grew up on the island of Oahu in KAILUA and went to school, elementary school in Honolulu Elementary, high school at Punahou, and then from there I went to the University of Oregon in Eugene, then to the University of Iowa for my dental school. After that, I went into the Air Force for 3 years, and I was stationed in Korea.
And while you were in Korea, something very special happened.
I did. I met a beautiful young lady, very smart, attractive, and I ended up marrying her. So I brought her home to Honolulu.
And you have a teenage daughter?
I do. I have a daughter named Leah. She's 13 years old, and she's a beautiful ballet dancer.
How long have you had your practice?
I've had my practice for 30 years.
Yeah, so you've seen a lot of changes in technology.
Yes.
And you were a bit of an innovator in health, or you were an innovator in health, because you started doing mini dental implants right around 2000, 2001, I believe.
2001,
yeah.
yes. Yeah.
So what was the reaction like when you first started with the mini dental implant?
The reaction was people just took to it right away. I didn't have to explain it very much. It was very simple in concept, and it went well, and it still goes well.
Because you have conventional implants as well that you offer.
We do. We have conventional implants among other choices besides mini implants.
With the mini implant, there's a dentist across country in Buffalo, New York. We're talking about places in the country that you wouldn't expect somebody maybe from Honolulu to go to, but Buffalo is a good spot. And tell us about Dr. Todd Shatkin, because you keep up with all of the technology by going there to bring all of that information back here.
I have. I ran into Dr. Todd Shatkin, his ideas in, I believe it was 2005, and he was leading the way in terms of alternative uses of the mini implant. And basically he progressed the technology to where we can use the mini implants for other applications besides the lower front part of the mouth.
And that's why you are the leading expert. You are the mini dental implant expert in Hawaii.
I believe I am.
Yeah. So wherever people are watching from, anywhere in Hawaii, on any of the islands, they can come to your offices and get the mini dental implant procedure.
Yes, they can.
So for your 2 locations, give us the office locations again.
I have 2 offices. One is in KAILUA. The address is 1058 KEOLU Drive. The other office is in town, right by the Alamana Shopping Center. And the address is 1331 South King Street.
And the website, to find out more information, and the website's pretty comprehensive, folks. It's called thesmilesforever.com. And the phone number is 808-762-2247. And we've seen you on television.
Yes.
With a lot of your spots.
Yes.
And so people are getting to know you now.
Give us a call.
So with that, you're getting out there and helping people. And I would think that has become very gratifying for you, because as you help people as a dentist and you've changed their lives, talk to us how the mini dental implant has changed their life.
I think the mini dental implant has changed their lives by allowing them just to eat better with their dentures and not worry about it. And it's very easy to take care of. Very little change in their life to enjoy the benefits of mini dental implants.
No matter what their age.
Right. So they can eat better, chew better, taste their food better, especially if they have lower dentures or missing teeth. And for eating things like steak or KAILUA pig, that's where the true pleasure comes in.
I had a lot of difficulty in eating.
I'd have to keep away from certain food.
I couldn't bite down on anything.
I wasn't able to eat solid food. I was very self-conscious. And I lost about 40 pounds.
But with these, I can eat everything.
It was done, overdone. Go home and eat.
I can eat steak, I can eat sandwiches.
From the moment I left here, minimal discomfort, even hours later, and I was able to pretty much eat whatever I wanted.
I can chew a steak. I could not do that before.
I can eat everything. It's unbelievable.
And my teeth aren't falling out of my mouth.
Just a whole newfound sense of security.
I can eat anything I want. I'll smile at anybody, It's outstanding. I'm happy. I'm very happy.
Problem is, I'm getting back the weight I lost.
I would imagine, Dr. Uchida, at some point, people are going to talk to you about cost. It's only natural when that comes up. And I know that you offer in your office affordable solutions. You work with a company called Care Credit. How does that work?
Care Credit makes it more affordable for people to enjoy the benefits of mini dental implants.
Yeah, because we are used to paying for things on time. We buy a house, we have a mortgage. You buy a car, you have a monthly car payment. And it's okay that you have a monthly payment for dental work, because you're making an investment in yourself. And it's an important investment, because if you're out there watching and maybe you're going to get into a new relationship or a new job, or you want to feel better, or like Dr. Uchida said, you want to enjoy the foods that we love here in Hawaii, you need to get this procedure done.
It does. It really helps you in your current life and in your future life. You're just simply investing in yourself, and it allows you to enjoy your social life again, and you're eating again, one of the few pleasures of life as you kind of get older. And,
we want to enjoy all those great foods. And the mini dental implant is 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive no matter what your age. We talked about some of the products being made in America. And when you go and meet with the patient, you have a kind of a 3D imaging that goes with that, because That's something that's very innovative. Again, the cutting edge technology at Smiles Forever. So you work with the patient to find out exactly where that mini dental implant is going to work.
Exactly. Before we do any surgery on the patient, we have our patient take a CAT scan at an imaging center, and basically we're able to find out where we should put our mini implants.
And
so everything's planned out.
Everything's planned out, and it's same day. So when someone comes in and they get the mini dental implant, you're released same day within hours.
Right, exactly.
So, and with the conventionals, a little longer, but with the minis, it's a fast, almost pain-free experience.
Exactly, and with oral sedation, patients don't even remember it.
Let's talk about that, because in your practice, and just reading some stories on your website from some of the patients, the fact that you offer that helps a patient get through the dental procedure. How important is the sedation?
It really is. Oral sedation's been probably the #1 thing we've done for our practice since I've started practicing dentistry. They're in a semi-conscious state, so they're not completely sleeping. They can usually respond to us when we talk to them, but they don't remember it after. And I believe it really helps with any discomfort they may have after the surgery.
Let me read some of the testimonials that I've seen online, and these are readily available, and I'm reading them right off the web for you folks. Dr. Uchida and his team are experts at complex dental procedures. They are also kind and trustworthy. Very important words there. They treat you like an extended family. You know, that's very important. They go the extra mile every time this particular patient had issues. They were taken care of. Cannot recommend them more highly. And here's the one I like. Dr. Uchida is a good guy. So,
I believe I'm a good guy.
Yeah, I believe you're a good guy. But that interaction with the patient is very important, isn't it? Because everybody's different.
It's totally important. And, you know, in our office, we try to get to know the patient. We ask them a lot of questions, and we try to feel where they are, feel really where they are and what it is that they are looking for. And sometimes they don't really come out and say it verbally, but we kind of have to pick up on their cues and then, you know, their body language and what's going on, just to try to figure out what's going to make them comfortable. Hi, I'm Dr. Steven Uchida. Do you suffer with loose dentures? Does your lower denture slide around like it has a mind of its own? Are you embarrassed to smile because you're missing teeth? I have the solution that will free you from these uncomfortable feelings. Let me give you your self-confidence back and give you the ability to eat the foods you love to eat but can't. You will be able to smile and laugh out loud again without the worries of your dentures falling out. Mini dental implants are your affordable solution, and I've been placing them with amazing results. Call me today at 808-762-2247 for a free consultation, and let me change your life forever.
Mini dental implants are 5 times less invasive, less pain, less healing time, less visits to the dentist, and the cost to you is less than half of the traditional implants. Call Dr. Steven Uchida today at 808-762-2247 to schedule your free consultation and let him create that winning smile. You have some photos on your website of some patients, real folks, you know, who've gotten it done.
Yes.
What did they say to you after the mini dental implant or the procedure that they got?
I wish I would have got this done a lot sooner.
Sure.
That's very common. I hear that over and over again.
Did they feel like their lives were changed for the better?
I believe so, yeah, of course, yeah.
Because they're smiling more.
Exactly.
I'm sure that's what you see first.
And for a lot of my patients, some of them sing. They professionally sing. So it helps them with their ability to sing.
So their ability to sing, and not only that, their ability to look their best.
Exactly.
Because you can be you again with the mini dental implant procedure.
Exactly.
Yeah. We should mention the website, thesmilesforever.com. You see some of those patient testimonials there. And when we talk about why people don't go to the dentist, and we just read some testimonials there about what a wonderful experience it is to go to the Smiles Forever offices that you have at your practice. But some people may be watching Innovations in Health right now saying, I don't want to go to the dentist. I had a bad experience. Why are people so hesitant?
Typically, people are hesitant because of their fear of pain, and going to the dentist and having pain, or else cost. Cost is another big one.
Right.
Yeah.
And so much of that has changed. So if you haven't been to the dentist in a while, and the mini dental implant is a procedure that could change your life, this is something that's practically pain-free, and the cost, we're going to work it out.
We're going to find affordable options for the patient.
Yeah.
And we have the little pill, which is an oral sedation pill, that we can give to the patient so they don't remember their appointments.
Right, but they'll remember you, Dr. Uchida.
Hopefully.
Yeah, because you're a good guy.
Thank you.
That's what they say. And let's talk a little bit about the pain, because an Advil or an over-the-counter medication can mitigate whatever small, slight pain there is.
A lot of times it does. A lot of times our patients don't even need any pain medications after the surgical appointment. And we ask them the next day, we call them the next day, and they said they're fine.
When you care for the mini dental implant, so someone's watching this now and they're going to go and they're going to see you and they're going to get it done. How do you care for the mini dental implant?
It's very simple to care for the mini dental implant. Basically, we use a water pick and a toothbrush.
And I bring that up because so many people with their dentures are so used to, my mom, God rest her soul, had dentures, and putting it in the cup and the fizzy stuff, and that's all gone.
It is.
You don't need that anymore.
No, it's basically like taking care of your natural teeth again.
Yeah.
Yeah.
And have that confidence level all over again. If you've just joined us, we're talking to Dr. Stephen Uchida, Smiles Forever. That's the practice, 2 locations, and we'll get to those in just a minute. Smilesforever.com is the website. But we're talking about the mini dental implant. And if you've been with us for the whole half hour, now it's really going to make sense again. I'm going to start, Doctor, with the lower denture example. Show us again what we just described, how that confidence is back and the lower denture is stable.
So basically in the lower denture, we have 4 mini implants in the front here of your lower arch, and your lower denture will snap on just like that.
Look at that. And show us what you're famous for. We've seen you on TV.
I like showing people the
doing
stability
the
of the mini lower overdenture, just like that.
So imagine if someone is in a situation where their denture has fallen out, like you had said earlier, they sneeze and they go, or they're stuck in a cake.
Yes.
Or they try to bite into the fish and the luau's that we enjoy here, but they have a problem. The stabilization and the confidence and the fact that they can enjoy food again must be a monumental experience for them.
It is. The upper denture and the lower denture are like apples and oranges. A lot of times people can wear the upper denture pretty successfully, but the lower denture is the one that people have most of the problems with. It's like it has a mind of its own.
Yeah. I've heard you say that. Now, here is an upper denture example, and with the upper, show us why that sense of taste comes back.
Well, here's the upper denture that we use for the overdenture, and basically what we've done is with the mini implants, we're able to remove the palate, this part of the denture that typically covers your hard palate on the upper. That allows your tongue to feel and taste your food again.
The fact that the palate is exposed, the sense of hot and cold, that the patient has just resigned themselves to not experiencing with the upper, doesn't have to be.
Right. So it's just like not having your denture up there again.
Yeah. This is another example. This takes it a step further, everybody, because this is almost as if you have a full set of teeth.
This is called the fixed on 6. They are 6 to 8 implants, and basically they are retained just like that.
So the titanium post holds all of that into place, and it is as if you have a full set of teeth. And if you look at the difference here, folks, between the fixed on 6 and the upper, see how much less plastic there is, an interior you call it. Yeah, see how much less that is. So that really makes a difference.
It does. It's just a lot less in your mouth.
Now, we talk about God giving us our baby teeth and our adult teeth. And now, Dr. Uchida, you're going to give us a brand new set of teeth. This is sort of the ultimate experience in the mini dental implants.
That's true. This is called the roundhouse. And basically what you have is 10 to 12 mini implants on the top and a set of teeth that are cemented right over those mini implants.
So that's a permanent solution.
This doesn't come out.
Yeah.
This is just like your natural teeth.
You're going to still clean them with the water pick, but this is a situation where it's in for good. So
just like your natural teeth.
Yeah. Now, we talk about situations where people lose a tooth.
Right.
You know, it must be so embarrassing, particularly in the front, a tooth is out. I can't imagine a more embarrassing situation. And it happens, whether the tooth goes bad, you knock it out with a fishing pole, there's some sporting accident, no matter what your age. The mini dental implant with a single tooth option.
So what we can do for a single tooth is we can put a mini implant right where the tooth root used to be. And it's very hard to see because those mini implants are very small.
Very good too.
And we simply replace that missing tooth with a crown. And it fits over the mini implant, and it is cemented, so it doesn't come out again.
And we should mention, folks, as we mentioned earlier, but if you're just joining us, that tooth is custom made just for you. This is not something that comes out of a box.
Right. This is all handmade and custom made for the patient.
Yeah, made in America products too. FDA approved, the mini dental implant, 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, less expensive. And you want to take Dr. Uchida and his team up on this, because if you have teeth in the back and you're saying, well, it's out of sight, out of mind, it's something nobody sees, this example that you're going to show us is very important, because those back teeth are vital to how we eat and the health of our body.
Right, so what we have here are teeth that are missing in the back, and we simply replace them with mini dental implants. Like you see 4 mini implants right there, and we cement them right into place just like that.
And that's in place, and you clean them with a water pick. It's practically pain-free, and it's a procedure that's done in the office.
Right, you clean them just like your natural teeth.
Yeah.
Yeah.
And then you have another option that you're going to talk to us about, the all-on-4 zygomatic, which is something that is another procedure that you'll talk to your patients about.
Right, the all-on-4 is one procedure, and the zygomatic's another procedure.
Okay.
But they are also options that we offer in our office besides mini implants. And it's good to compare different options for the patients, just to go through the whole list of what's technologically available for them.
So you'll work with the patient on all kinds of options that are affordable for them.
Yes,
because you want to have the best life. I like your line, with family, friends, and food.
Right.
And if you can get all 3 together, that's a perfect experience.
It's a bonus.
What motivated you to become a dentist?
Dr. Ronald Miller, my dentist when I was growing up, motivated me to become a dentist. He's just a nice man, and he allowed me to find jobs that were available and test out the field of dentistry. It just so happened that I loved it. I still love it today, and I'm very grateful for him to have introduced me to the field of dentistry and to take the time to talk to me over the years through college and my career in the military. And then after even, we still talk to each other.
Yeah, because you're in the Air Force, and
Yes.
again, thank you for your service there.
You're welcome.
Yeah, and so much with that mentoring, and you can see how passionate you are for your patients. You're excited to tell us about the mini dental implant procedures and everything that you do at your office.
I am. I just love talking about it, and I like bringing new technology to people and, putting it to work. Practical applications of the technology.
Tell us where you're at one more time, Doctor.
We have 2 offices. We're in KAILUA at 1058 KEOLU Drive in the Enchanted Lake Shopping Center. And our town office is near the Ala Moana Shopping Center on South King Street, 1331 South King Street.
And the website is thesmilesforever.com, and the phone number 808-762-2247. As we wrap up, Doctor, we'll line up all these models here, because this is the mini dental implant procedure. We've been talking about it here on Innovations in Health, a procedure that will change your life, where you can be you again. Dr. Uchida, you are an innovator in health here in the great state of Hawaii, in all of the islands. Thank you for joining us.
Thank you.
And good luck to you and your family.
Thank you.
And thank you for watching.